Order, order. Jim Shannon to move the motion.
Can I beg to move that this House has considered measures to reduce the alarming increase in drug deaths across the United Kingdom, Great Britain and Northern Ireland. First of all, can I thank all of the right honourable members for being here. Much subscribed debate. With that in mind, I'll try to work to a certain time scale to ensure that everyone gets in. I understand there's 9 speakers. Mr Chairman, it's preventing drug-related deaths, an issue that touches communities across all 4 nations of this United Kingdom. And can I say what a pleasure it is to see the Minister in her place, and I look forward to her responses to our questions that we will put forward. I was saying to the Minister beforehand, there's another debate in the main chamber, but even I can't compete with being in 2 places at the one time, so impossible. This is the priority, and that's why I'm here. Let me begin by over the last decade, drug deaths have increased by 85% in England and Wales, 122% in Scotland and 47% in Northern Ireland, an unacceptable situation by any measure. Northern Ireland has the highest second drug-related death rate in the UK, nearing 5 times the European average. And each one of those deaths represents, I believe, a profound tragedy, because it's not just the person who dies, which is a tragedy, it's the families who are affected. I want to stress that each and every one of these deaths are preventable. The situation demands urgent action. The recent data from the Northern Ireland Statistics and Regional Research Agency paint a deeply concerning picture. Drug-related deaths in Northern Ireland have risen again, albeit after a slight decrease in the previous years. And behind these numbers are human beings, fathers, sons, mothers, sisters, daughters. Those are the people affected. Most alarmingly is that young adults aged between 25 and 34 are dying at the highest rates. Even more stark is that those people living in our most deprived communities are 5.5 times more likely to die from drug-related causes than people in our least deprived areas. In my constituency of Strangford, we have not been immune to this crisis. However, we have managed to remain resilient in the face of this by retaining lower drug-related death rates compared to any other area in Northern Ireland. This is no accident. Mr Chairman, it reflects the dedication and compassion of local drug treatment service providers who, despite limited resources, tirelessly support our most vulnerable citizens. So I sincerely thank them, put on record my thanks for them for their perseverance and expertise. And without their dedicated efforts, countless more lives would have been lost. Frontline drug treatment providers in Strangford speak passionately about the daily challenges they face, and there are 3 key areas I wish to highlight as priorities for action. Firstly, drug treatment service workers from Strangford stress the urgent need to integrate mental health support within drug treatment services. Drug misuse often masks deeper issues of trauma, of anxiety, of depression, and in Northern Ireland in particular, with a 30-year conflict that we've had, there is a history that's left a lasting impact on the current generation. This issue, however, is pervasive across the United Kingdom as well. Research indicates that 70% of people in community drug treatment have reoccurring and co-occurring mental health needs. And moreover, an investigation into coroner's records of people who died from drug poisoning found that a mental health condition was noted in at least 2/3 of those cases. Yet 14% of the individuals were in contact with mental health services only. A quarter, 25%, had a history of suicide attempts, rising to 50% amongst those whose deaths were classified as suicide. So mental health, #1 issue when it comes to drug deaths across this great United Kingdom. I know the healthcare system and local authorities share a clear responsibility to provide comprehensive support. Far too many suffering from both mental health issues and substance misuse are excluded from vital services. So I believe it is deeply concerning that mental health services often turn away individuals due to their substance use, which I think is wrong, and I put that on record, while drug and alcohol treatment services cannot accommodate those deemed to have mental health conditions considered too severe. The cycle of exclusion as well disproportionately impacts people with serious mental health illnesses, leaving some of the most vulnerable trapped between providers and unable to access the care they desperately need. A similar point was made by the Honourable Member for Liverpool Walton, was made 3 years ago at a previous Westminster Hall debate that I attended. It begs the question, Minister, I know, and I'm very pleased to see the Minister in her place, and it's our second or third Westminster debate, I understand, but what progress has been made since that debate was held here 3 years ago? There is another critical barrier that we must look at, one that also impacts, and that is stigma. Stigma surrounding drug use isolates people, silences their cries for help, deters them from engaging with essential services and reintegrating into society, compounding mental health struggles and prolonging the suffering. So let's not stigmatise those who are drug users. Let's help them. And I think that's my big request for today in this debate. It's crucial that we challenge those harmful attitudes within our communities, our health services, and indeed within these Houses of Parliament, within the members, within government who have a responsibility. Addressing stigma means recognising that addiction is a health issue, not a moral falling, as some people might think it is. And I'm not being disrespectful to anybody else, by the way, but I just think that's the way I would look at it, and I hope that others would absolutely, yeah.
I'm very grateful for the honourable member calling today's debate. The last government had a paper from harm to hope. However, it fell really short of where Dame Carol Black had set out the vision of how we get on top of the significant harm that people experience. Does he agree that we need a public health approach to substance misuse, and alongside that, having harm reduction units so that people who are users can access services at a level where they can get the care and support that they need in order to then make those first contacts with professional services?
I certainly, Mr. Chairman, can I first of all thank the Honourable Lady for her intervention. And she and I agree on many things, probably on lots of things, by the way, I suspect. But at this point, we're on the same page directly. And I'm going to come to Carol Black's report and some of the recommendations that come with that there. The Honourable Lady has preempted that there, but it set the scene for what will come afterwards, and I thank her for that intervention very much. A 2022 YouGov poll found that 2/3, 66% of Britons believe that government is doing too little to address addiction in our society. So there's an obligation, I believe, respectfully to the Minister and to government to do something about this, because 66% of the nation wants something to happen. Perhaps even more telling, almost half, 49% of Britons see addiction as a mental health issue, calling for compassionate, health-centred responses. So very clearly what they're about. In contrast, only 19% think addiction should be treated as a criminal matter. Again, something to think about and something to be focused. While addressing the stigma underlying mental health conditions, we simply cannot hope to tackle drug dependency and its harms effectively. We must end this harmful practice and ensure that integrated support is available to everyone who requires it, and that our mental health care and drug treatment service systems are properly equipped and working in a joint approach. This brings me to the second point very, very quickly. I'm conscious of time, Mr. Chairman. I'm sorry. The current practice is ineffective. It prevents services from planning ahead, denies the security necessary to retain their staff, and undermines, I believe, the long-term programmes to clients. Sometimes the commitment, and not being disrespectful to any, never my way of doing things, Mr. Chairman. The previous, well, cast it back to the before the government came into power, they were approached with short-term stop-gap budgets. We need something long-term, something with a continuity that can bring about to recruit, first of all, and to plan strategically. And I believe that is what we should be focusing on. The report goes further, noting that short-term funding causes delays in commissioning services and recruiting new staff, leading to service gaps and workforce instability. Instability in the workforce is on the front line, on the cold key we call it back home, doing everything at the first person you meet, the first person you see, the first person you need help from. This instability, I believe, described as a deprofessionalisation of the treatment workforce, damages the quality of care. The underspending has been identified, Mr. Chairman, as 22 million. 15% across the treatment and recovery stream. Again, we really have to dash this. Dame Carol Black is the name in front of me here in big letters. Review to improve funding and rebuild the decimated drug treatment workforce following the 40% real terms reduction in funding witnessed from 2012 to 2020. She refers to, and I quote her, disjointed approaches, struggling staff, increasing costs and decreased funding. Given these challenges, it's no wonder the services are unable to provide the quality that it needs. We must shift, I believe, to a model where people feel welcomed and cared for in drug treatment services. where interventions foster engagement, trust between clients and key workers, and where we uphold promises to reduce harm, lessen pressure on the health and justice system, and ultimately, I believe, strengthen our communities and help the people that we represent in this chamber. Harm reduction is an essential lifeline for individuals and communities across Northern Ireland, and indeed across this whole great United Kingdom. It is evidence-based in Northern Ireland, it's compassionate, it places and people at its very heart, meeting them exactly where they are by providing accessible, low-barrier support service. Harm reduction saves lives by preventing overdoses and reduces the spread of infectious diseases, because that happens to those who are using needles, and significantly improves both physical and mental health outcomes. Harm reduction does not enable drug use, it enables life. It enables the saving lives. It enables the restoring dignity and reconnecting people to their communities. That, I believe, has to be the goal for us in this debate today, and obviously through the Minister and those who will participate. The harrowing statistics laid out previously demand a revisit of the Misuse of Drugs Act 1971, legislation now over 50 years old and never formally reviewed. I think it's time, Mr Chairman, honourable members, that we had a long, hard look at where we are and where we need to be, and done in a professional, compassionate method forward. The Act restricts many harm reduction interventions that international evidence has shown to be effective, but which we cannot fully implement here. We must ask, in the face of ongoing deaths, the unreal rise in drug deaths and the undeniable potential for more, whether this legislation remains fit for purpose. During the election campaign, I say this respectfully, because members will know that it's not my form to attack anyone, but I just quote this for the record. The Prime Minister, who I respect greatly, and he indicated in his campaign trail he would not make changes to the drug policy. I think it's time we did, and that's the point I want to make. I want to say that respectfully to the Prime Minister, who I have great, utmost respect for, but I think it's time to have more flexibility, meaningful change, and to adapt to a changing drug market. In recent years, the UK has seen a surge in synthetic opioids, dangerous, highly potent substances peddled by unscrupulous organisations that rob families of fathers, of mothers and children. They must be stopped. That's why we need a drugs debate, a drugs policy in place that will do just that. It has become clear that simply classifying substances higher or imposing longer sentences is not enough. And if it's not enough, then we've got to look at a different way of doing it. Nitizenes, which are up to 1,000 times more potent than morphine, have already claimed the lives of hundreds in the UK, and their presence in the illicit drug supply is rising. According to the latest drug-related death statistics, opioids were the most common drug associated with drug-related deaths in Northern Ireland. I believe those figures are replicated in the mainland here as well. If we don't act now, the situation will only become more devastating. Dame Carol Black and her review on drugs has said there's some progress. So let's not be churlish. There has been advances, there has been steps in the right direction, but has it went far enough? I don't believe it has. I think others will probably confirm that. And government recently passed legislation expanding the provision of the life-saving drugs in Barcelona used to reverse opioid overdoses. So I welcome these changes. I understand the need for them, but they are not enough. I'm sorry to say that. We really have to have a new look at it. We're falling behind our international partners in tackling the crisis, failing our constituents in safeguarding them, and allowing criminal organisations to profit immensely from the illegal drug trade. Chairman, harm reduction should not be controversial. It's simply about saving lives and mitigating the harms associated with drug use. Historically, the UK led the world in harm reduction, and Liverpool being the birthplace of efforts to reduce drug-related deaths and infectious disease. Every 90 minutes in the UK, someone dies from a drug-related death. This means that during the time of this debate, at least one life will be lost. And 10 years ago, it was every 2.5 hours. So it is becoming incredibly serious. We must act now. If we're truly committed to ending the crisis, we must go beyond the medical or indeed the behavioural solutions that some put forward. On a related issue, death by suicide is also a serious concern. The honourable gentleman, I'm not sure if he's here, he's not here, who did the German debate on Monday night, referred to suicides in Rother Valley, and where 70% of suicides in Northern Ireland are men. the majority of them occur in the private area. The very thing that the honourable gentleman said in his adjournment debate on Monday night are the things that are happening in my constituency and across the whole of Northern Ireland. A new standard, BS 30480, is being drafted by people with expertise in the policy area and will bring forward comprehensive guidelines to support organisations develop effective suicide prevention strategy. So those are some of the things I wish to say. I'm coming to the end. I'm very conscious, Mr Chairman, that there's 9 people to speak, and I want to give every one of them the chance to make their contribution. So I'm going to finish with these comments. In Strangford, a local drug treatment service implemented a programme designed specifically for the friends and families of people who use drugs. It provides a vital space where they can support each other, learn from each other and realise they're not alone. How important it is to not be alone and think that the whole world's against you and you have to try and get through yourself. They also train loved ones in the naloxone administration so that they can save a life if necessary and discuss the risks of drug use and how to mitigate them. Most importantly, they bring the community together, everyone together, like a team effort to try and put your arms around people and have a shared purpose. Caring for those who hold dear and supporting them through the challenging journey of addiction. I'm told the response has been overwhelmingly positive. I want to tell that story because when we look at the darkness of what this debate's about, we also have to see the light that can shine and take us to somewhere where we can be better. And I think that's what I want to do. As a country, we must do the same, and act collectively with similar compassion and purpose. In closing, I must stress that drug-related deaths are not inevitable. They result from choices made with respect in this House. The United Kingdom possesses both the expertise and the evidence domestically and internationally to act decisively. And we have, I believe, Mr Chairman, a moral obligation to safeguard our communities, to reduce pressure on our strained healthcare systems and spend money responsibly. So I call upon government and upon the Minister in particular. The responsibility of responding to this debate is on the Minister's shoulders. I know will not be found wanting in relation to it. So we need to prioritise the lives of our most vulnerable citizens, to protect the healthcare system, to act preventatively against drug-related deaths and commit to a fully funded, evidence-based harm reduction approach. If we do that, and today this debate can be the first step in moving that forward, Mr Chairman, I believe we'll have done a job, an honourable job on behalf of our constituents, but also to discuss this very difficult issue. Drug deaths across this great United Kingdom of Great Britain and Northern Ireland, they're too high, they have to come down. We have to have a new strategy, a new way of looking at it. I've suggested some of the things in my constituency that we can do in Northern Ireland, and I look very much forward, Mr Chairman, to hearing all the right honourable and honourable members' contributions. Thank you so much.
There's a lot of interest in this debate. I would not set a firm limit on speeches. However, an indicative 3 minutes, I would suggest, should get most people in, but probably not all. Can I remind members, if they want to speak, they're going to have to indicate that they wish to do so. The question is that this House consider the prevention of drug deaths. I call Graham Morris.
Thank you very much, Dr Murison. It's a pleasure to serve under your chairmanship. And I would like to congratulate my good and honourable friend, the member for Strangford, for securing this really important debate. I find myself not for the first on the first occasion agreeing with much of what the honourable member said in his opening remarks. Clearly, drug deaths are at a record high, mainly from opioids, but deaths from cocaine have risen by almost a third. And as my honourable friend said, the synthetic opioids, such as the fentanyls and the nitazines, present an increasing and alarming threat that I don't think has been properly quantified. We've seen the growth in deaths across the Atlantic, and I suspect it's a much bigger problem here than we know about. There's no doubt about it. It's a public health crisis. And sadly, the northeast of England has had the highest rate of drug deaths in England, 3 times higher than in London. In the latest stats released in October of last year, the North East recorded 174 deaths per million compared to an England average of 90. Too often in the communities I represent, I've seen people turn to drugs because of deprivation and despair, and once addiction takes hold, it often leads to crime. It's no coincidence, Dr Murison, that drug deaths are highest in the areas of greatest deprivation. The data is clear. Communities struggling with poverty and inequality are also those communities hit hardest by addiction. It's not a new problem. Certainly it's a complex problem, but it's been exacerbated by disinvestment in harm reduction and drug treatment programmes. And if we are serious about tackling this problem, we really need to do something different. To some, a tougher crackdown may seem like the obvious response, but we've had over 50 years of evidence showing that punitive drug policies do not work. The war on drugs has failed, not just in the UK but globally, and we simply cannot arrest our way out of this crisis. That is why today I want to offer a different perspective, one that moves beyond outdated one-size-fits-all approaches. Abstinence-based recovery is certainly one path, but it's not the only one. If we truly want to reduce drug deaths and support recovery, we must reduce harm, reduce stigma, invest in treatment provision with protected, ring-fenced and sustained long-term funding. This funding could support solutions like opioid substitution treatment, which saves an estimated 1,000 lives annually, medically supervised overdose prevention centres, such as the Thistle Safer Consumption Facility in Glasgow, heroin-assisted treatment and the increasing availability of drug testing. These measures are crucial in addressing the current crisis and saving lives. As chair of the Drugs, Alcohol and Justice APVG, which is supported by treatment providers VIA, Way Through and With You, I recently had the honour of chairing a meeting where Professor Sir Michael Marmot, the leading expert in health inequalities, laid out the stark reality, and he told us social injustice is killing on a grand scale. He made it clear that areas of the greatest deprivation suffer the deepest cuts during austerity, exacerbating addiction and its consequences. I would encourage the Minister, indeed all government ministers, to consider how we as a nation can adopt the Marmot principles, principles that foster a fairer, more equitable society, a society where everyone is given the best possible start in life and where we work to prevent deaths of despair. If I may, Dr. Murison, I'm very conscious of the time, but I just want to mention a dear friend of mine who's no longer with us, the late Ron Hogg, who was the Police and Crime Commissioner in Durham. He was a true pioneer of drug policy reform. He was bold, compassionate and unafraid to challenge the status quo. He introduced heroin-assisted treatment and diversion schemes at a time when they were far from popular. But popularity wasn't his goal. He was seeking to reduce harm, save lives and ease the burden on our criminal justice system. The evidence is clear. Investment in treatment works, harm reduction saves lives, tackling stigma is essential. We must stop seeing addiction solely as a criminal justice issue and instead treat it as an urgent public health emergency.
Speeches mean more colleagues get in. I call Susan Murray.
Thank you very much, Dr. Murison. It's a pleasure to serve under your chairmanship. I'm grateful for the opportunity to address this important issue which the Honourable Member for Strangford has brought before us today. The UK's outdated drug laws intended to protect citizens have deepened harm and opened the door to criminalised gangs. This has led to a state where in 2023 we saw nearly 7,000 deaths from illegal drug use, a tragic failure to shield vulnerable people from the dangerous reach of the illegal market. The so-called war on drugs, championed by successive governments, has not halted the supply of harmful substance. It has neither reduced addiction nor prevented the disastrous impacts on families and communities. This emphasis on enforcement has allowed underground networks to thrive and ultimately neglected the fundamental public health challenges at hand. We have clear evidence that we need to switch to a new approach, an approach where compassion and understanding of addiction as a medical issue guides decision-making. I have seen the impact that this switch can have firsthand having recently visited the Safe Consumption Facility in Scotland and 2 which are well established in Norway, which allowed me to see how such facilities not only save lives but also help communities and allow addicts to access services and to get the care and support that they need. By offering a clean, monitored environment for those who are dependent on drugs, these centres have reduced open-air drug use in surrounding areas, helped more people to step onto the path of treatment and support, and have saved the lives of users. So it is with the lives of these users and our communities in mind that I would like to urge the Government to focus attention on 3 vital reforms. First, transfer the policy lead from Home Office to the Department of Health and Social Care, ensuring that addiction is tackled as a health condition, not merely as a criminal matter. Second, invest in robust, evidence-based addiction services, which make help readily available and eliminate waiting times. And third, replace criminal penalties for simple possession with civil penalties where appropriate, empowering treatment options over punishment. By enacting these measures at a national level, we can send a clear message, putting people's health first, saving lives and restoring dignity to families and communities that have borne the brunt of drug-related harms. Most importantly, we will begin to break the cycle of ineffective criminalisation, offering hope and a genuine path forward for those struggling with addiction. Thank you.
Mr McAllister.
Thank you, Mr Chair. It's a pleasure to serve under your chairship, Dr Morrison, and can I thank the honourable member for Strangford and congratulate him for securing today's very vital Westminster Hall debate. Mr Chair, I would, with your leave, like to begin by paying tribute to Christine McKelvey, MSP and Scottish Government Minister, who sadly died today. Christine was taking leave for cancer treatment. She is the Scottish Government Minister for Drug and Alcohol Policy in the Scottish Parliament, and our thoughts are with her partner, Keith Brown, MSP, and her family, Mr Chair. In my West Dunbartonshire constituency, drug-related deaths increased this year. Figures released in August of 24 from the National Records of Scotland showed that in Scotland 1,172 people died in Scotland due to drug misuse, an increase of 121 deaths. In my constituency of West Dunbartonshire, the rise, that's a very small local authority, the rise was from 20 to 26, involving 9 females and 17 male deaths. Deaths from opioids, including heroin, morphine and methadone, were implicated in 80% of those deaths. I wish to pay tribute to Alternatives, a West Dunbartonshire community drug service. It does incredible work, both the staff and the volunteers, to tackle this issue of drug addiction and offer support across my constituency, as does the West Dunbartonshire Drug and Alcohol Partnership. There is, of course, as the honourable member mentioned in his opening remarks, there is, of course, a person, a family and a story behind every statistic, and it's very important to remember that. Mr Chair, people in the most deprived areas of Scotland are more than 15 times as likely to die from drug misuse compared to people in less deprived areas, and I suspect it's the same for Northern Ireland and across the United Kingdom. Mr Chair, the Scottish Government and the UK Government need to do more. The evaluation of the National Drug Deaths Mission report released last month found that only 1 in 3 alcohol and drug partnership coordinators believed that the Scottish Government leadership was effective. The report makes it clear that those who understand the drug death crisis best do not have faith in the SNP Scottish Government leadership. So the SNP must listen to frontline workers and work with them to deliver the funding this essential mission needs, properly fund local government and reverse the cuts to our local health and social care partnerships who fund and support the frontline organisations across West Dunbartonshire, such as Alternatives, and across our country. Thank you, Dr Morrison.
Harry.
to serve under you, Dr Morrison, and thank you to the Honourable Member for Strangford for securing and leading this debate. This is an issue of great concern to me and my constituents in Brighton Pavilion. Between July 2023 and June 2024, more than 160 people attended A&E at the Royal Sussex County Hospital in Brighton because of drug-related overdoses, and in 2023, 46 people died due to drug poisoning-related deaths in my constituency. Every drug death is a preventable, devastating tragedy. The organisation Anyone's Child, Families for Safer Drug Control, amplifies the voices of those who have been directly impacted by drug policy failures, and this organisation is now calling for the legal control and regulation of the drug market. For the last 12 years, drug deaths have increased each year in the UK, while the supply and trade has only become more violent, toxic and exploitative, especially for children. We should be declaring a public health emergency. And I believe that policing, stigma and criminal records cannot adequately address this crisis, while compassionate care, stability in housing and employment and access to treatment can do this. But currently, preventive treatment is very patchy across the country. There's inconsistent funding, cuts to public health budgets and inappropriate targets. And when a person is defined as a criminal for using drugs, they will be deterred from seeking drug-related services and support. The reality is that people are using and supplying drugs, and instead of keeping them safe, government policy currently is stigmatising and criminalising them. And I also believe that the government's current punitive law and order approach is having terrible consequences for marginalised communities who experience violent over-policing, especially black people, who are 4 times more likely to be stopped and searched mainly for drugs than white people, despite this being completely disproportionate to drug use patterns. Therefore, like others, I would urge the Minister today to outline positive steps to take drugs out of the hands of organised crime and into those of health professionals through legal regulation. I want the Minister to outline steps towards significant and sustained increases in funding for drug treatment services, steps towards removing legal barriers for harm reduction interventions, including the drug consumption facility such as in Glasgow, mentioned by the Honourable Member for Mid Dunbartonshire. I want to see steps towards the evidence-based decriminalisation of drug consumption and a longer-term roadmap towards legal regulation. Chair, to conclude, we have the evidence on how to address this crisis and save these lives, but do we have the will?
Warren Didgers.
Thank you, Dr. Morrison. It's a pleasure to serve under your chairship, and I thank the honourable member from Strangford for this debate on a very serious and important topic. Across England and Wales, there has been a 113% increase in drug-related fatalities in the last decade, and it cost the government around £20 billion a year. Since 2012, these deaths have been rising steadily in line with austerity measures introduced by the previous government, and that has resulted in a reduction in funding to treatment services. The National Audit Office reported that between 2014 and 2022, real terms funding for drugs and alcohol treatment in England fell by 40%. It's indeed the case that deprivation does lead to more drug deaths, but even in my own constituency of Wolverhampton West, which may not be as deprived as some of the areas in the northeast of England, in Wolverhampton we've had a sharp rise in drug-related deaths since 2021, reaching levels above the national average. I would like to hear what the Minister has to say about what funding is going to be made available specifically to deal with drug addiction. Public Health England recently found that 50% of those dying from opioid use had not been in contact with any support services in the last 5 years. Dr. Morrison, we need to take a holistic approach to the problem of drug misuse, investing in our mental health services, reducing the levels of deprivation, and encouraging those who use drugs to engage with the services that we offer. Reducing the number of drug deaths will also be incredibly cost-effective, resulting in a reduction in drug addiction and also crime associated with drug usage. We've already had Dame Carol Black mentioned this afternoon. She has found that for every £1 invested in harm reduction and treatment services, this gave a combined return to both the health and justice systems of £4. I'd like to finish by emphasising the need for us to continue to support and fund the amazing work that certain organisations do focusing on drug abuse. We have the charity suit as part of Wolverhampton Voluntary and Community Action in my constituency of Wolverhampton West. This is a peer-led service which provides a service throughout Wolverhampton, and it is led by people who have personal and first-hand experience of drug and alcohol abuse. They not only give support on addiction recovery, but issues such as mental and physical health, well-being, homelessness, employment, welfare and housing, and they also tackle the stigma of drug usage and discrimination. Dr. Morrison, we need to be investing and supporting such organisations.
Charlotte Nichols.
Thank you, Dr. Morrison, and I would like to thank the member for securing this crucial debate. As pointed out by other members, the statistics are harrowing. But how have we gotten here? A decade-long disinvestment in drug treatment services, approaches more fit for scoring political points than actually solving a problem, a complete disregard for the expert guidance provided by the Advisory Council for the Misuse of Drugs, and an utter lack of expediency. Given these factors, it is little wonder that we have ended up in this position. My work as the unremunerated chair of the Centre for Evidence-Based Drugs Policy has shown me that practical measures exist which can make a real difference. Diamorphine-assisted therapy has a robust evidence base for helping people who have not responded to other treatment modalities reduce their illicit drug use. A DAT clinic in Middlesbrough demonstrated extraordinary outcomes: a 97% attendance rate, an 80% reduction in street heroin use, and a drastic drop in criminal activity from 541 offences before treatment to just 3 in the same period following treatment. These outcomes translated into an estimated £2.1 million saved across the health and criminal justice sectors, in addition to the lives saved. Tragically, this clinic was closed due to fragmented, unsustainable funding, yet another example of short-term thinking undermining long-term gains. In Glasgow, the Drug Treatment Service, which offers a similar model, has estimated that its services have resulted in a 50 to 70% reduction in health service costs. We are not alone in calling for these changes. A 2023 report by the Home Affairs Select Committee made it clear that harm reduction must play a far greater role in UK drugs policy. Their recommendations offer a pragmatic roadmap, and the government must act on them if it is serious about reducing drugs-related deaths. Most of these interventions require only minor amendments to the Misuse of Drugs Act 1971, legislation that, after more than 50 years, appears increasingly unfit for purpose. Currently, this legislation blocks the establishment of safer drug consumption facilities, overdose prevention centres, and the distribution of vital harm reduction paraphernalia by qualified drug treatment services, including safer inhalation pipes, which remain illegal under Section 9A of the Misuse of Drugs Act 1971, even though corner shops can legally sell dangerous, poor-quality pipes with no health oversight under the guise of ornaments. A pilot is currently taking place in parts of England with police support and shows promising early results, including reductions in high-risk practices and increased awareness of the harms associated with drugs and how to reduce them. There are a number of services within my own constituency which I'm very proud of, but for the House's time I will not detail. But this is Change, Grow, Live, and I pay massive credit to the work that they do. When stigma shapes policy, Chair, we see punitive laws, fragmented services and inevitably soaring mortality rates. When compassion and evidence shape policy, we see reduced deaths, safer communities, diminished profits for criminal organisations and better returns on public investment. This is not just a moral health imperative, but a public health necessity.
David Williams.
It's a pleasure to serve under your chairmanship, Dr Morrison, and I thank the honourable member for bringing forward such an important debate. We've seen some of the worst outcomes for drug-related deaths in Europe In England and Wales, as we've heard, there was an 85% increase in drug deaths between 2013 and 2023. Meanwhile, spending on drugs and alcohol services decreased by around 40%. And in Stoke-on-Trent, spending on treatment for drug misuse fell by 21% between 2019 and 2023. Preventive services must remain at the heart of our approach. As we've heard, an independent review reported that for every £1 spent on treatment, £4 is saved by reducing demands on health and justice services. In Stoke-on-Trent and Kidsgrove, residents have been concerned about young people inhaling butane gas, aerosols and nitrous oxide. However, there is no currently available public measure in England and Wales for deaths associated with these substances. The absence of a public measure of mortality makes it difficult to understand the depth of this problem. And another key local concern is monkey dust. That's the colloquial name for synthetic cathinones. Use of monkey dust in our town centres and parks worries people, and cracking down on its use is critical to our Safer Streets mission. I want people like my own mum and dad to feel safe when they're out and about. Now, the community safety team at Stoke-on-Trent City Council do excellent work in this field. They do regular walks of our towns and parks alongside the police and drug service teams, offering support to those directly who need it. The Advisory Council on the Misuse of Drugs has suggested a series of interventions to tackle the rise of monkey dust use. This includes expanding trauma-informed treatment for vulnerable people and encouraging stronger collaboration between housing, health and justice services. We know that drug dependency is also linked to deprivation, and men in the most deprived areas are 6 times more likely to die from drug use, and for women that risk is almost 5 times. And in Stoke-on-Trent, our annual rate of drug deaths was 10.8 per 100,000 between 2020 and 2022, double the level for England. There are fantastic community organisations in Stoke-on-Trent North and Kidsgrove, like Walk Ministries, Expert Citizens and others, and they work tirelessly to address the issues on the ground. And I'd also like to thank Stoke-on-Trent Community Drug and Alcohol Service, whose work is critical locally. Finally, I would like to raise the devastating fact that Stoke-on-Trent has one of the highest levels of infant mortality anywhere in the country. And we know that parental drug use is linked to sudden infant death syndrome, as reported by the National Child Mortality Database. More must be done to address the impact of drug harms on children and families. Therefore, I close by asking the Minister to consider the merits of a cross-departmental strategy to address the impacts of parental drug use on infant health and mortality.
Patricia Ferguson.
Thank you very much, Dr. Harrison, and it's a pleasure to serve with you in the chair. And I congratulate the Honourable Member for Strangford for bringing this important subject forward for debate today. I'd wish to associate myself with the comments of my honourable friend about Christina McKelvey. I served in the Scottish Parliament with Christina for some 10 years, and she was, perhaps ironically, a real lover of life and a force for good. Yeah. But my contribution today will focus on an inquiry which the Scottish Affairs Select Committee is currently undertaking. That inquiry is into the operation of the Safer Drug Consumption Facility in Glasgow, the first of its kind in the UK. My contribution will be entirely factual, as I do not want in any way to prejudice the inquiry or to preempt any decisions that the committee may make. But it is an important issue and one that is relevant to today's debate. To give some context to the rationale for the Safer Drug Consumption Room, Scotland has the highest number of drug deaths in Europe by some margin. In 2023, data tells us that some 1,172 people died just in that year alone, and that's up 121 on the previous year. Much of the action that can be taken to address this problem comes under the powers of the Scottish Government, but that, of course, does not include issues arising from the Misuse of Drugs Act of 1971. The Scottish Government has introduced a variety of measures, but it is specifically about the drug consumption space that I want to speak today. There are now some 200 such facilities in 12 countries around the globe, And the Scottish Parliament Information Centre explains that, and I quote, several long-term evaluations indicate that attendees of drug consumption rooms engage in safer injecting practices and reduce public injecting, leading to a significant decline in HIV and hepatitis C transmissions and fewer ambulance call-outs for overdoses. The idea of such a facility in Glasgow was first raised more than 10 years ago, but a variety of issues, including the reluctance of the then Lord Advocate, meant that the pilot facility only opened in Glasgow in January of this year, following considerable public engagement and after the current Lord Advocate provided a statement of prosecution policy. While the possession of drugs remains a criminal offence, the Lord Advocate has indicated that it would not be in the public interest to prosecute users of the facility, and I stress it's the facility alone, for simple possession offences subject to certain limitations. The Scottish Affairs Committee visited the Thistle, as the Glasgow facility is known, last month and saw for ourselves what was on offer. Users have access to a shower and can receive treatment for wounds and other health issues associated with their addiction. Discrete spaces where users can inject are also available, and staff can offer clean needles. Users bring their own drugs, but staff can give advice when they become aware that a particularly strong or pure drug might be in circulation, so that users are aware of potential dangers. Clients can choose to stay at the centre for a time after injecting, and so far 2 overdoses have occurred on the premises, but these were dealt with either on site or in other locations, and both individuals made a recovery. Staff, of course, can also signpost clients to other services. To date, and it did just begin in January, there have been over 140 unique service users, more than 1,000 visits, over 700 injecting episodes managed on site, and the prevention of some 700 to 800 items of drug-related litter in public spaces in the vicinity of the centre. 80% of the clients are male. The Thistle is a pilot scheme, Dr Murison, and will be carefully reviewed and analysed over the next 3 years to ascertain whether it has helped to reduce bloodborne viruses and other drug-related harms and death. What has become clear to the committee, however, is that the staff working at the Thistle are dedicated and committed, are welcoming and non-judgmental, and I would encourage members to look out for a report when it is published.
Lillian Jones.
Thank you very much. Under your chairmanship, Dr Morrison, and I thank the Right Honourable Member for securing this very important debate. I may also associate myself with the comments regarding Christina McKelvey, MSP. I stand before you to address a crisis that has devastated lives, families and communities across Scotland. It's a crisis that demands our attention, our compassion and, most importantly, accountability. I am speaking about the tragic rise in drug deaths in Scotland, and a problem that for far too long has been exacerbated by failures in leadership and policy, particularly under the SNP Scottish Government. A constituency visit a few weeks ago to Patchwork Recovery in Kilmarnock certainly reminded me of the enormity of the crisis during conversations with people who were sharing their thoughts and their experiences about the deaths of family members and friends due to drugs, expressing the deep suffering and loss of those individuals. Now, the Scottish Government must start delivering a genuinely joined approach to tackle the drug deaths crisis and ensure that every single person struggling with drug misuse can get the care, support and treatment they need. For too long, the SNP Government has failed to address the crisis in a meaningful way. Despite Scotland's long-standing recognition of its drug death problem, the Scottish Government's approach has been too slow, too reactive and too piecemeal. While other countries have taken bold action to tackle opioid crisis and improve access to treatment, Scotland's response has been inconsistent and insufficient. This stems from drastic cuts to public services over the last decade. Glasgow is at the centre of the drugs epidemic, with a highest rate of drug misuse death in Scotland for period 2019-23. The Thistle facility in Glasgow is the UK's first official consumption room for illegal drugs, which is being appropriately scrutinised by the Scottish Affairs Committee as to the effectiveness of protecting Glaswegians who are impacted by drug abuse. The SNP's approach to harm reduction is inconsistent. There remains gaps in the availability in crucial services such as detox, rehabilitation and mental health support. And it's no secret that drug addiction is often tied to underlying mental health challenges, yet too many people struggling with both have nowhere to turn for help. The lack of funding for rehab services and the slow pace of reform shows a government that is not focused on the drug crisis or prioritising the lives of its citizens. Scotland's drug deaths crisis is not just about the statistics. It's about people. It's about mothers, fathers, sons and daughters whose lives have been cut short because the response from those in power was inadequate. 1,171 deaths. How many more lives need to be lost before real change happens? How many more families must be shattered before the Scottish Government takes full responsibility for the tragedy? The SNP has had years to make meaningful change, and yet we continue to see preventable deaths and suffering. We can no longer afford to ignore the crisis. We need urgent action from the Scottish Government. It's time for a comprehensive, compassionate and coordinated approach to tackling drug deaths, one that prioritises the health and well-being of those affected. We need better access to treatment, we need more rehabilitation services, and we need a focus on addressing the root causes of addiction. Scotland demands better from the SNP Government. The families who have lost loved ones, the communities that are hurting and the individuals who are still fighting addiction deserve better. They deserve a government that is willing to act decisively without hesitation to save lives.
Lee Ingham.
Thank you, Dr Harrison. It's a pleasure to serve under your chairship. I also thank the honourable member for raising this debate, as drug-related deaths and the importance of prevention is an issue that affects many across the country, as well as obviously across all of our constituencies. We know that drug misuse is a complex problem with many causes and impacts, but one thing is clear: the current rates of death are completely unacceptable. In 2022, there were 7,912 alcohol-specific deaths. There were also 5,448 deaths related to drug poisoning registered in England and Wales in 2023. This is the highest number since records began. It's also a tragedy that has to stop. We cannot allow this crisis to continue unchecked. Now, last week in Business Questions, I raised how important community services are in supporting people with substance misuse issues. One example that stands out in my own constituency of Stafford, Eccleshall and the Villages is Chase Recovery, a truly innovative, community-based, peer-led rehabilitation programme. I recently had the privilege of visiting Chase Recovery, where I saw firsthand the incredible impact it's having on the lives of those seeking recovery from substance misuse. It's not just a treatment programme, but a lifeline for those who need it most. It offers a holistic, supportive environment where individuals can recover, rebuild their lives and develop new skills and confidence. Truly, I couldn't describe it as anything more than a really welcoming and supportive community. During my visit, I had the pleasure of meeting Paul and Cara, who run the organisation, two incredibly passionate people who lead the programme with incredible dedication. Their drive and their commitment to helping others is truly inspiring. They're making a difference every single day, and I have no doubt that the work they're doing is helping people achieve long-term recovery and to rebuild their lives in a meaningful way. It's programmes like Chase Recovery that prove how community-based peer-led services can play a vital role in sustainable long-term recovery. But those programmes do need support from government to ensure that they can continue their vital work and reach even more people in need. It only takes one helping hand to change someone's life, and I would like to encourage the Minister to outline not only what the government is doing regarding prevention, but for community-led treatments as well.
Lewis Atkinson.
Thank you, Dr Mills. It's a pleasure to serve under you this evening, and I pay tribute to the Honourable Gentleman for securing this debate. As colleagues have said, 5,448 drug-related deaths in England and Wales is truly a public health crisis, and we need a response that meets the urgency of that crisis. I reflect that when the last Labour government came into power, drug-related deaths were approaching the 2,000 deaths a year mark. And that was considered serious enough at the time to implement a new national drug strategy with funding, with setting up a national treatment agency to provide evidence-based treatment. And that was then with 2,000 deaths a year. And the effect of that was that drug-related deaths, which had been inexorably rising for a decade or more, levelled out and stopped rising, and that thousands of lives were saved and lives improved. And I know that a little bit because it was the privilege of my NHS career to manage NHS drug treatment services in the North East of England for 3 years when that strategy and that system was in place. A harm reduction approach was key to treatment as set out by other colleagues, and I won't repeat that. But that, the harms of drugs, clearly horrifically deaths as we're talking about today, but the wider harms as well in terms of the impact on crime. The amount of acquisitive crime in this country that is driven by addiction is really significant, and a government focused rightly on tackling crime as well as wider health things. This is an intervention that meets a lot of the government's missions. The harms also around children taken into care as a result of parental drug use. That a prevention approach that reduces costs for the state by ensuring appropriate drug treatment. And that drug treatment, particularly in terms of the use of opiates, has got to be focused around opiate substitution therapies. We went through the evidence base is absolutely there, and we spent a disappointing time in the last decade where ideology against opiate substitution treatment trumped the evidence base, and we have people not alive here today as a result of that. So the scale of the treatment gap is really significant. In Sunderland, in my constituency, we have adult mortality from drug causes about twice the average in England, but around 60% of opiate and crack users are not in treatment today, and that must change. So I absolutely welcome this debate. I'm really looking forward to the Minister's response. I would observe that under the last Labour government, the policy and the health landscape was rather different. As well as the policy urgency, there were clear national levers to pull, the National Treatment Agency for Substance Misuse being a primary one. But since then, we've moved to a more diffuse system, not just at centre of government, but having this commissioned by each council individually through the public health grant. The provider landscape itself has fragmented, whereas NHS treatment services used to be more the norm. Now there is a pattern of significant commissioning, in some cases competitive tendering, every few years. And I don't think that has helped get this issue tackled with the urgency that it needs. So I look forward to hearing from the Minister, and I don't think there's legislation required here to improve treatment. It requires clear political will and focus, and I hope we'll hear a lot more of that, but both today, but actually in the coming months of this government. Thank you, Chair.
Very briefly, Ewan Steinbank.
Thank you, Dr. Wilson. It's a pleasure to serve under your chairmanship. I thank the Honourable Member for Strangford, and I'd like to associate the remarks from Scottish colleagues around Christina McKelvey. In Falkirk, from 2010 to 2023, 333 people lost their lives to drug misuse. Our worst year being 2018, where 43 people died. Every one of those people is a family member, someone's child or parent, tragically or prematurely taken. Part of the reasons, as was touched upon, that is so high is because Scotland has the greatest number of drug deaths anywhere in Europe. I want to use this speech briefly to talk about where we've gone wrong and what we've started to get right. While I acknowledge that it was only one tool in the arsenal of public health responses, medication-assisted treatment such as methadone has shown to significantly reduce overdose deaths. The abandoning of Scotland's 10-year drug strategy decades ago is a failure that should teach us the lesson of never returning to unscientific, moralising drug policy, but focusing on real action and harm reduction. More recently, harm reduction policies such as naloxone distribution has saved lives by reversing opioid overdoses in Falkirk. The Falkirk ADP have taken incredible steps in encouraging awareness and use of naloxone, and I pay tribute especially to Phil Heaton, the lead officer at the Alcohol and Drugs Partnership in Falkirk. We should go further on harm reduction, safer drug consumption facilities, proven to reduce overdose deaths in other countries, and piloted in Glasgow, extensively touched upon by my honourable friend from Glasgow West. These sites provide medical supervision, sterile equipment and a gateway to treatment for those ready to take the next step towards recovery. Instead of wrongly expecting people to just go cold turkey, that doesn't work. I want to briefly talk about that harm reduction does save lives. Drug addiction is not a spontaneous phenomenon. It is deeply intertwined with social and economic conditions. People in Scotland's most deprived areas are over 15 times more likely to die from drug misuse than those in the wealthiest. We need a holistic approach that looks at root causes, poverty and deprivation. When looking at drug deaths, we need to also think about demographics. Many of those dying today in Scotland first became addicted in the 1980s and 1990s during the economic shock of deindustrialisation and maligned with stigma and a lack of support. The average age of drug misuse deaths has increased from 32 in 2000 to 45 today. Now in middle age, the health of that generation is failing fast, making them more vulnerable to fatal overdoses. We need to look at these demographic changes and where we're failing. Addiction treatment, alongside chronic disease management, financial support for the disabled and mental health services are all essential factors here. I acknowledge this is not an easy issue for governments to tackle. It is wrapped up in dozens of policy points and often involves those that the governments find the hardest to reach. Most of all, it's an issue of injustice, a lack of opportunities and a general social failure. We need to take our communities with them, listen to them, but also take real action now.
Lib Dem spokesperson Jess Brown-Fuller.
Thank you, Dr Morrison, and can I thank the Honourable Member for Strangford for bringing forward this important debate. And I'm particularly pleased to see the Minister in her place, which shows the Government's recognition that this is in fact a public health issue. Every drug-related death is a preventable tragedy. Every life lost represents not just statistics in a report, but families shattered, futures lost, and communities often left to pick up the pieces. So we do have a moral obligation, both as a government and as a society, to do better. The reality is stark, and that has been laid out very well by members across the House in today's debate, and drug-related deaths have reached record highs. These are not just the consequences of addiction, but often the result of inadequate support, stigma, as has been mentioned by many honourable members in today's debate, and a failure to adopt evidence-based strategies. In 2023, there were over 5,000 deaths related to drug poisoning registered in England and Wales. This is the highest number since records began in 1993, and an increase in 11% on the previous year. And my local hospital in Chichester is recording hundreds of A&E attendances every year where drug use is recorded. For too long, the response to drug use has been focused on criminalisation rather than treatment. But as honourable members have said today, we cannot arrest our way out of this crisis. Those struggling with addiction need access to healthcare, not to handcuffs. That means properly funding rehabilitation services, expanding mental health support, and ensuring that no one seeking help is turned away due to lack of resources. For me, Dr Morrison, this is personal. I have witnessed family members self-medicate with drugs when mental health support was unavailable to them, and my own dear dad battled with alcohol addiction throughout his adult life, and although it was a related cancer that took him in the end, the addiction had taken him away long before that. In fact, it's one of the many reasons I am proud to be a Liberal Democrat when we pledged in our general election manifesto to provide mental health MOTs at key points in our lives when we are most vulnerable to a change in our mental health. And I often wonder if my dad would still be here today had he ever had the opportunity to tell a professional that he was struggling. Dr Morrison, across the world, we have seen that harm reduction saves lives. I'd like to acknowledge the role that hardworking GPs, nurses, community pharmacists and other health professionals play in the support of access to medication and safe consumption spaces, which is taking an evidence-based approach and using it to prevent deaths. And in Scotland and Glasgow, as many members across the House have mentioned, where drug deaths are at crisis levels, pilots of safer consumption rooms are now underway. I was pleased to hear that my honourable friend from Mid-Dunbartonshire, along with other colleagues across the House, have visited these centres, and we should be looking at these models with open minds and not outdated ideologies, because the goal is simple. We need to keep people alive long enough to access their treatment and rebuild their lives. And as the Honourable Member for Warrington North said, the saving that we find across health and justice far outweigh the investment in centres that is needed. And we also need a joined-up approach across the country that lays out the most effective pilot projects so they can be further rolled out to other areas. The Public Accounts Committee identified in their report in February 2024 that there were delays in allocating funding of the 2021 drug strategy to local authorities and a continued lack of understanding about what works to prevent people from using drugs. It's unacceptable that there was a 14% underspend in the funding allocated to the strategy in 23-24 when it is clearly desperately needed across the country to prevent these deaths. And of course, prevention must also mean cutting off the supply of dangerous drugs at the source. We need stronger action against organised crime groups profiting from misery. That includes tackling county lines operations which exploit vulnerable young people and push deadly substances into our communities. Dr Morrison, this is not a partisan issue. We must work together across all of our benches to ensure that harm reduction prevention and rehabilitation are at the heart of our national strategy, because at the end of the day, it's not about politics, it's about people, and ensuring that families do not have to endure the heartbreak of losing a loved one to drugs. At the core, it's about saving lives. Thank you.
Shadow Minister Dr Caroline Johnson.
Thank you, Dr Morrison, and it's a pleasure and a privilege to serve under your chairmanship. I'd also like to pass my condolences to the family and friends and colleagues of Christina McKelvey, who I know means a lot to many of the people in this room. Members on all sides will recognise the vital importance of the topic before us today in our health and well-being as a nation. Let us be clear, deaths across the UK remain too high, and in many cases trends are moving in the wrong direction. And therefore I congratulate the Honourable Member for Strangford for bringing forward this important debate so we can talk about it further today. The ONS, the Office for National Statistics, notes that 5,448 deaths related to drug poisoning were registered in 2023 across England and Wales, which equalises to 93 deaths per million people. But these headline figures, of course, only tell part of the story. Each one of those figures represents a tragedy and a family. We know that a significant gender imbalance exists in drug deaths. Of those 5,500 roughly deaths in England and Wales, there are 6,345 affected men and 1,803 affected women. There's also a imbalance amongst the English regions, as the Honourable Member for Easington said, with the North East of England remaining the region with the highest rate of deaths related to drugs, and in London a third of that rate. And I want to ask the government what steps they're taking to understand the epidemiology of drug use and how they're using that information to account for policy development to reduce drug use and drug deaths. Another key demographic trend relates to age. ONS survey data for 2024 shows that 16.5% of people aged 16 to 24 report using at least one drug in the year to March 2024. Approximately 150,000 people in the same age bracket considered themselves frequent drug users. So education is clearly going to be a vital element of any strategy designed to prevent people becoming addicted to drugs, going on to cause harm to themselves and their community. That education needs to be clear about the damage which drug consumption does to individuals and which it does to society, from antisocial behaviour, environmental pollution and serious organised crime committed by gangs. So what steps is the government taking to ensure that schools and colleges are providing effective targeted education to young people? What conversations has the Minister had with the education ministers about this? And what are they doing to extend that education to those who are lost to the system, who are not attending school and therefore at greater risk of developing addictions and of being exploited? We also need to understand the changing patterns of use around particular drugs, and this is something that's been mentioned in the debate so far already. Fashions change, and we must confront today's challenges proactively rather than yesterday's ones reactively. Deaths involving cocaine rose by 30% in a single year from 20 to 23. Synthetic opioids like fentanyl pose another emerging risk. We know that these substances have caused catastrophic harm in other countries where they are already a fixture of the drug supply chain. What lessons has the Minister and has government learned from other countries' experiences with synthetic opioids? What steps are they taking to ensure the risk does not develop into the sort of crisis that we have seen across in other countries? And behind the statistics, of course, there are people who use drugs, people in our communities who suffer the impacts. And we need to look at both of those and also to the patterns of drug use. Inner city areas suffering multiple forms of deprivation may, for example, face greater problems with substances like heroin. Members have said already that the Scottish Government recently opened the UK's first drug consumption room in Glasgow with a view and an intention to address that kind of drug use. The long-term evidence regarding the effectiveness of these rooms is not clear at this stage, and so in that respect I'm pleased the Government, as a UK position, does not see a wider implementation of the strategy as a way forward. Treatment must be evidence-based, compassionate and effective. It also must not be done in a way that undermines the law, risking more people thinking that drugs are safe or not risky to use. I will, yes.
And that's kind of the status quo in terms of the position. But shouldn't we be challenging the status quo, and shouldn't we be looking at the evidence? For example, the position in prisons. One might assume that someone who's incarcerated because of their crimes due to drug addiction would receive treatment in prison and would be rehabilitated. What happens in practice is they're actually worse when they come out. Budoval, which is a long-lasting drug, isn't readily available, which could be very effective. Does the Shadow Minister have any views on that?
I completely agree with the honourable gentleman that we should have evidence-based policy, and we need to challenge and probe whether the way we're doing things are right, whatever the policy is, whatever the area of policy that we're looking at. Drugs shouldn't be available in our prisons, and people should receive treatment if they've gone into prison with a drug-related offence. So I think that's, or they go in with a non-drug-related offence but are a drug user. I think that's fairly. They should have treatment. Of course, they should have treatment. But they shouldn't also have access to drugs within prisons, because they are a controlled environment, and we should be able to prevent them. And the government might have some more information. The Minister might be able to update us on what they're going to do to try and reduce the amount of drugs available in prisons. It's also the effect on the local area around a drug consumption room. What are those effects? What effect does allowing people to use drugs have on the wider society of crime, violent gang, acquisitive crime and drug use in terms of numbers? I think that evidence needs to be looked at very closely. And there are other... Bless you. There are other contexts in which drug use has caused problem too. Media coverage in recent years has highlighted the problem of so-called middle-class drug taking in family homes or at dinner parties. These are different patterns of use with different problems and may risk setting precedents and norms, particularly for young children who may witness them, and that might have their own damaging effects in years to come. This drug use also still may be occurring in middle-class homes, but is still fuelling organised crime, violence elsewhere. What is the government doing to address these nuances and different habits and social contexts of drug use, and how does that figure in their policy development? We should also think about the prevalence of drug use in contexts like workplaces. Some workplaces, such as the police, use intermittent drug testing. Police can use stop and search powers to investigate misuse, but there are other opportunities to interrupt harmful behaviour. So what is the government's position on random drug testing in employment settings? Regarding the group of people in communities blighted by the effects of drug use, it's important to enforce the law as it is. In 2021, only 20% of drug-related offences recorded in Home Office data resulted in the user being charged or summoned. 34% of those offences resulted in an out-of-court or informal settlement. Some today have seemed to suggest that treatment and law enforcement is an either-or, but actually both are very important. Minimising the criminal offence risks increasing the use, de-risking first trying of drugs among young people, and emboldening drug dealers and further harming the neighbourhoods suffering drug-related harm. According to the ONS data for 2024, 39.2% of respondents to the crime survey for England and Wales said it would be very or fairly easy to obtain illegal drugs within 24 hours. How does the government intend to reduce the availability of illegal substances? The last government implemented a 10-year drug strategy following the publication of the independent review of drugs undertaken by Dame Carol Black in 2020. The last government committed an additional £532 million investment in 2025, up to 2025 to improve capacity and quality of drug and alcohol treatment services. The strategy set out aspirations to prevent nearly 1,000 deaths and to deliver a phased expansion of treatment capacity with at least 54,500 new high-quality treatment places for sufferers of addiction. The present government needs to set out a coherent and viable plan for tackling the problems which the previous government had begun to address. On the 26th of November last year, the Under-Secretary of State Baroness Merrin noticed that the government continues to fund research into wearable technology, virtual reality and artificial intelligence in a bid to support people with drug addictions. At a cost of £12 million in the period from the election to 26th of November, so can the Minister update the House on what evidence she has on the effectiveness of these measures? How do they intend to value the outcomes gained from that £12 million investment? And does she have any results on how effective that they were? So in conclusion, Dr Morrison, drug use continues to cause substantial harm to individuals and communities across the UK. The government must commit to evidence-based interventions and plan the UK drug strategy in a manner which limits the opportunities for individuals to distribute or consume drugs, reduce the likelihood that young people will develop an addiction, and prevent communities from suffering the impacts which come with ineffective policing and ineffective sanctions.
Minister.
Thank you, Dr Morrison, and it is a pleasure to serve under your chairmanship. I would like to start by congratulating the Honourable Member for Strangford on securing this debate. He raises a number of important points, and let me begin by agreeing that the rise in drug-related deaths across the UK is deeply concerning. I'd like to thank all members, honourable members and right honourable members, for their contributions. This is something that we in the Department of Health and Social Care are aware of, even at a personal level. Just last month, Dr Morrison, a homeless man known as Paddy died of a drug overdose just around the corner from 39 Victoria Street. Paddy was known to many civil servants and was noted for the gentle way he looked after his dog. His death, less than a 10-minute walk from this place, should remind us of the stark realities that many people face every day. It serves as a painful reminder that while we in this chamber discuss policies and politics, real lives are at stake on our doorstep. And Paddy's story is not an isolated one. It's a tragic reflection of the systemic issues that continue to affect vulnerable people in our society. His death has brought home most vividly to us that behind every statistic is a human being who deserves dignity, care and support. And my family too, Dr Morrison, has been affected by drug-related death. And as I rise to speak today, my cousin Stephen, who we lost in this way, tragically young, is at the forefront of my mind. Because there is no doubt that illicit drugs have a devastating impact on our communities across the 4 nations of the United Kingdom. Drug misuse deaths have doubled since 2012. Over 3,300 people died in England alone in 2023, and that's the highest rate since records began in 1993. Drug and alcohol deaths are the leading cause of premature mortality in those under 50. And these deaths are preventable. And this government is committed through our health mission to ensure people live longer, healthier lives. As was raised by the Honourable Member for York Central and Mid-Dumbartonshire and others, and as the Lib Dem spokesperson pointed out, we recognise that this is a public health issue, and it's why I, as the Minister for Public Health, am standing at the dispatch box today. We're also determined to make our communities safer, more secure and free from the violence caused by the illicit drugs market through our Safer Streets mission. And whilst the opposition seem to have sent the Shadow Minister from Health to speak almost entirely about criminal justice issues, I will focus most of my comments on the public health areas, and I will write to her afterwards with some of the details she raised. We know that many people struggling with drug addiction are already at the sharpest end of inequality, often with multiple and complex needs. The links between homelessness, deprivation and people who spent time in prison with addiction are profound. And tackling the blight of illicit drugs is an issue that cuts across our 4 nations. It is crucial now more than ever that we work together and share learning to tackle the harms that drugs cause. My department continues to work very closely with our colleagues in the devolved governments, and I'm grateful for the ongoing collaboration. And I take this opportunity to put on record and add my voice to the condolences to the family and friends of Christina McKelvey. I look forward to meeting with ministerial counterparts in the devolved governments later this year to discuss how we can continue to work together to reduce drug-related deaths. In terms of the harms caused by drugs, the Honourable Member for Mid-Dumbartonshire and Brighton Pavilion have raised some issues around the Home Office and public health. This is a mission-led government. And whilst I stand here as a public health minister, we will continue to work closely with the Home Office and education and across government on the drugs agenda. I met with Dame Diana Johnson just last week to discuss this complex issue. Whilst we have no plans to decriminalise drug possession, prohibiting drug possession helps reduce the availability of drugs and sends a clear signal that drugs is normal. We support programmes that divert drug users away from the criminal justice system and into treatment. And if we are really going to shift the dial on drug-related deaths, we must ensure that anyone with a drug problem, wherever they are, can access the help and support they need. And this means providing evidence-based, high-quality treatment. These dedicated drug treatment services reduce harm and provide a path to recovery. My department is continuing to invest in improvements to local treatment services, which faced significant cutbacks in the past. During a decade of disinvestment, and the local authority funding allocations for 25-26 will be announced imminently. And I recognise my honourable friend from Stafford's contributions about the importance of community-based treatment. I will.
I'm very grateful, and I'm very pleased with the Minister's response. I do appreciate she has an awful lot on her plate with cancer services, piloting a bill through the Commons yesterday. But would she agree, given that we're looking at evaluating the evidence and what works best, would she agree to meet with me and a small group of representatives from the treatment providers, and then they can explain in person what they think is the most effective way to tackle this issue?
I thank my honourable friend for his intervention. I'd be delighted to do so. As he knows, consultation and engagement is at my very core, and I'd be happy to meet with him and others. My department has also invested an additional £267 million in 24-25 to improve the capacity and quality of drug and alcohol treatment services, alongside £105 million made available by DHSC, the Department for Work and Pensions and the Ministry of Housing, Communities and Local Government to improve treatment pathways and recovery, specifically for people who are sleeping rough, and housing and employment support. The Government has also awarded £12 million to projects across the UK that are researching innovative technology to support people with addictions and prevent drug-related deaths. As of January this year, there were 43,500 more people in drug and alcohol treatment, including more than 4,500 children and young people, and 12,500 more people in long-term recovery. There are around 340,000 people in structured treatment in England, which I'm pleased to say is the highest on record. The honourable members from Mid-Dunbartonshire, Brighton Pavilion, Easington, Glasgow West, Kilmarnock and Loudon also referred to the drug consumption rooms. On drug consumption rooms, this Government recognises the exercised prosecutorial independence of the Lord Advocate in respect of the pilot drug consumption room known as the Thistle in Scotland. We will, along with the Home Office, consider any evidence emerging from the evaluation of that pilot in due course, and will report on that in due course. My honourable friend, the member for Warrington North, talked about safe inhalation pipes, and I will write to her with further information on this in due course, as there is an academic research study underway to test their effectiveness, and OHID is a part of the advisory group and waiting to see the findings. On mental health and trauma often lie at the heart of substance use issues. People with co-occurring mental health and substance use problems find it hard to engage with support, and services too often fail to meet their needs, and this must change. We're committed to ensuring cohesion between mental health and substance use services, meaning that people no longer fall through the gaps of treatment. My department has developed, jointly with NHS England, a mental health action plan to tackle this very issue, which I hope will be published soon. The honourable members for Falkirk, member for Falkirk talked about naloxone, and a few other people have mentioned that as well. And I know that tackling drug-related deaths is a key priority for all four nations. I'm proud that together we've legislated to widen access to naloxone, Dr Morrison, the life-saving medicine that reverses the effects of an opiate overdose. We know that over half of people struggling with opiate addiction are not engaged in treatment at all. This means that significant numbers of an incredibly vulnerable population are at increased risk of overdosing and dying. The UK-wide naloxone legislation that came into force in December 2024 enables more services and professionals to supply this medication, which in turn makes it easier access to people at risk and for their loved ones. We're also working to set up a registration service in England, which will further expand access to naloxone. We're highly alert to the growing threat posed by synthetic opioids, as has been raised by many honourable members today, including the honourable member for Wolverhampton West and Easington. These synthetic opioids, such as nitazines and fentanyls, are often more potent and more deadly, but naloxone remains an effective medicine for synthetic opioid overdose. The Government is undertaking a range of actions to prevent the rise of these dangerous drugs, working with colleagues across the devolved governments, and this includes increased surveillance and enforcement. To the honourable member for Stoke-on-Trent, I thank him for raising the important issue of children affected by parental drug use. Our mission-based approach will ensure that every child has the best start in life and that we create the healthiest generation of children ever. And this includes supporting the children of parents with drug problems and other adverse childhood experiences. My department is leading work to improve the health system's ability to respond to and support the needs of those people that have drug addiction and multiple and complex physical health needs. Intervening earlier and treating co-occurring physical health conditions will reduce drug-related deaths and improve recovery outcomes. The Office for Health Improvement and Disparities has an action plan in place to reduce drug and alcohol-related deaths. And I was pleased to announce on the 1st of May this year, my department is hosting a national Preventing Drug and Alcohol-Related Deaths event, where we'll work with the sector to agree priorities. Chair, I would once again like to thank the Honourable Member for Strangford for bringing forward this debate. I can assure you this government is committed to reducing the harms illicit drugs pose to both individuals across wider society. These deaths are avoidable, and I'm confident that the government's mission-led approach will put us in a stronger position to tackle this complex issue. Harm reduction and strong public health approaches is at the heart of this government's work to prevent drug-related deaths.
Jim Shannon to wind up.
Mr. Chairman, first of all, can I thank all right honourable members for their contributions. I do hold numerous Westminster Hall debates, but I've never had as many people at a debate as I've had in this one. That illustrates, I believe, Mr. Chairman, the deep interest there is from all members and their ideas that they've all put forward. Some of those ideas are ones that were replicated, whether it be the centres and people giving examples of where we can have the centres where people can come with an addiction and they can wean them off and support them and give them the help that they need. Most of those have been from Scotland, to be fair, although we did do something, I think, similar to in my constituency back home. And can I also thank the Minister in particular for her reply. I think none of us could fail to be impressed. I say that genuinely, by the way, by the Minister's response. It certainly encapsulated, I believe, the feeling of us all in this chamber and what we're trying to achieve. The Minister referred to our Paddy who lost his life just a few steps away from this place. I think an example of just how real it is for people. And also the Honourable lady referred to Stephen, I think it was her relative who's suffering and problem as well. She referred to the public health issue as recognised by Minister in her response. She referred to tackling the blight of drugs, and I really welcome the Minister's commitment to having those discussions with devolved governments and bringing us all together, Scotland, Wales and Northern Ireland, and get a strategy. Drug addictions is directed to treatment rather than criminalisation. That's the thrust of what I was trying to put over. And to be fair, almost everybody, indeed everybody did put over the same idea as well. The Minister referred to £260 million commitment for drug treatment pathways. Welcome that. Also referred to £12 million for research for drug-related deaths in the UK. The Honourable lady reminded us, and forgive me for the Honourable member who said it, but he reminded us about children. And sometimes when you look at the addict, you don't see the child. But the person who did that, forgive me for not being able to say who that was. I haven't been notes here, but if I look through it, take me just to find it. And I just want to say to that person, that honourable member, that's really important for us all to remember there's children left sometimes when parents go astray. The Minister committed herself to addressing and giving support to that as well. So with that in mind, Mr Chairman, can I thank all honourable members for their contributions, significant contributions to a debate that needed to be had in the Westminster Hall, and the questions asked and the answers given. And for that, the Minister said she was a mission-led government. That's what it was. I'm really impressed. Well done. We look to see, keep an eye on you and make sure that we'll be mission-led. But we look forward to helping and supporting the Minister in the pathway that she's chosen to take us forward on. Thank you so much.
The question is that this House has considered the prevention of drug deaths. As many as are of that opinion say aye. To the contrary, no. I think the ayes have it. Order, order. Sitting suspended until 3 p.m.
not put my name in. It's there's one there.